Most of the news we watch these days centers on our present worldwide health crisis, but we really don't hear much about how it relates to diabetics. Are diabetics more likely to develop complications from this virus or any other virus that they might experience? I'll be interviewing an endocrinologist named Vladmir Carvalho who's living in China where all this began, and I'll be asking his insights about our worldwide health crisis and diabetes. Before we get to the interview, I want to share with you that since all the churches have closed, Benedict and I have been having home church, and we've recorded a couple of our little Bible studies that we've had in our home, and we've posted them on Benedicta's YouTube channel. If you've been missing church and you'd like to join us for a little Bible study and prayer, I'll leave a link in the description notes that will take you to our home church videos. Well, folks, I'm happy and blessed to have Dr. Vladmir Carvalho, who is like an old friend now. I've interviewed him once before as he is studying in China. And Dr. Vladmir is an endocrinologist, and we are thankful that he is going to share with us. Dr. Carvalho, thank you for participating and being willing to do yet one more interview.
Thank you so much. I really appreciate it. Thanks for having me here again.
Okay, well, Dr. Carvalho has his own outstanding YouTube channel, and we'll put a link to that in the description notes. But we're curious about what's going on in China. You're right at the epicenter of the coronavirus epidemic, or pandemic as it is called these days. And yet China seems to be getting some control over it. How has it been where you live? I said erroneously before you were in Beijing, China, but it turns out you're in Nanjing, China, so excuse the error. Have you had many cases of coronavirus in your area?
Not too many. You know, in the beginning it started, but the way the measurements that were taken here were very drastic, you know. When everything started, places here were on lockdown. For example, people that live in schools and places like that were not allowed to go outside. And I still have friends in school that cannot go outside to buy food or anything. You know, they're brought food inside the school. Yeah, and if they need anything more than that, they would have to call people from the school to go buy it for them. But for some of us that live outside, we can still go outside, but we need to wear masks. And every grocery store that we go to, there are people there that will check our temperature, and, you know, the regulations are pretty tough here, not the way I see some other countries doing. It actually feels like we're not not battling the same virus.
Well, you know, it sounds a lot tougher than we have it here in the U.S. So you walk into a grocery store, someone's going to be there to check your temperature and see if you have the virus. Is that what you're telling us?
They will check the temperature and see if it's high, then they will take you to the hospital and see if you have it. And the other thing is, if you don't have a mask on, you cannot get in. And then even inside, to get into your own building where you live, you also need to check your temperature, and they make sure you wear masks, and, you know. But now it's better, because now in Nanjing, from some days ago, we can go outside. Now a lot of places are being opened that we can go outside, because there has not been new cases for a long time. So if I want to go outside now, I can go.
Well, I tell you what the news we're hearing from China is good news, and that is that it seems like the worst is over. Even in Wuhan, where it all began, they're not having any more new cases. So whatever they're doing is working. They're a lot tougher than we are, but maybe we need to get a little more tough to be able to fight this virus.
Yeah, in Wuhan, they're a little bit more cautious than other places like Nanjing, where I am. Because in Wuhan now, they're trying to let people come out slowly, you know, one by one, and see how it's going to work. But of course, we need to be cautious. But it's much better than before. It's way better now, because I also have friends in Wuhan, some classmates and countrymates, and it's much better than before. Now they can just do some small things, but they still can't go outside and play or do, things like that.
So the restrictions are tough, but the good news is China seems to be beating this, and that's good news for all of us. We may have to be just as tough. How about you, doctor, and your family? Are you and your wife and your I think you have 2 sons, are you all well?
Yeah, we're well. We're doing well. For them, they have not gone outside for more than 2 months already. Myself, I've gone like a few times, like 3 or 4 times to just buy food. But then I just buy and come back. Now they can go outside, but we prefer to just wait a little bit, let the other ones go first and see.
Okay. So let's talk about diabetes and the coronavirus. Now, what I have read from the American Diabetes Association is that diabetics are not really any more likely to get the coronavirus than anybody else, but if they do get it, they're more likely to suffer complications from it or perhaps die from it. Is that how you see it?
Yeah. People with diabetes are more likely to die from almost anything. Because now we're talking about coronavirus, right? But normally there are some other viruses, other bacteria, there are many things that are trying to get into our body every day, every second. But our body will normally find a way to deal with it because our immune system, there are cells from our immune system that can recognize any foreign body and destroy it. But when we have something tough like this COVID-19, like this SARS-CoV-2, that's the name of the virus, that can replicate this fast and can spread this fast, then your immune system also has to be fast. But for people with diabetes, they have a few problems. I made a video about A1C, and I explained why we measure A1C, which is glucose attached to some molecules inside the red blood cells. And for us, we need to understand that glucose is not only in your body going up and down. They can be attached to different things in your body, different molecules, different proteins, lipids, and different things. So one of them is red blood cells, and we measure it as A1C. But other cells from your immune system, your blood vessels, other, signaling molecules, they can also be glycated. They can also have sugar attached to them. And when sugar attached to them, sugar can change their structure or function or both. And that can trigger your body to recognize that things have changed and start some inflammation. That's why we say that patients with type 2 diabetes or obese or things like that, we normally say that they have low-grade inflammation at all times if their blood sugar is higher than normal. So it's not actually about the corona thing, it's about your immune system that can't work properly because many things that are supposed to be working have sugar attached to them that will change their structure and function. To give you an example, if you look at our blood vessel, it looks like something long, like a tube. But it's not. It's just many cells, many small cells attached to each other that makes a long tube. So when your immune system needs to fight an infection, those cells, they need to be flexible and separate from each other and let the cells from the immune system with blood get to the area so that they can fight. But for people with type 2 diabetes or any other diabetes, their blood vessels will normally have some sugar attached to them and change the structures of those proteins and things on them. And then your immune system will start attacking them instead. So their blood vessels will be impaired. So even if your immune system can come to the area, they will have a hard time getting to the real location. So that's why patients with type 2 diabetes that have problems with feet, like foot, diabetes foot or diabetic foot. Some of them, if the blood can't get to one area, they have a hard time repairing that part. So that's why sometimes we just cut them, because it's better that way, because the blood is not getting there anyways. So this is the main problem with patients with diabetes.
Yeah, it seems like almost everything that can be bad in terms of health, a diabetic is just more likely to get it than a non-diabetic who is otherwise healthy. One thing I've had in my own life several times that is not pleasant are urinary tract infections. Is it your experience and understanding that urinary tract infections are frequent problems for diabetics?
Yeah, that one has two reasons. The first one is what I just said, that if there's any infection, we need your immune system to get to the location. But it's very difficult for people with diabetes. And the next one is that if you get an infection, especially if you have some bugs around an area, they also like sugar. They also replicate quicker if there's sugar around. So that's why there's the medications that increase patients' urinations, medications like SGLT2 inhibitors that increase patients' urination. They cause urinary tract infection because they put a lot of sugar there, and bugs love them. And for one more thing about the coronavirus is also the location, because everything that is happening, inflammation can happen in different places, your arms, your legs, your feet, but this one is happening in your lungs. And your lungs, you need them all the time to breathe. And this is a problem for everyone that can't breathe properly. And type 2 diabetics and people with diabetes are one of them. For example, people with cardiovascular disease, that if they try to run for 10 minutes, they don't have breath anymore. So they have problem breathing even in normal situations. People with type 2 diabetes or obese, they're in the same boat. So when you have something that's affecting your lungs, and it's bringing some immune cells with blood to your lungs, that can cause problems with breathing. But if you're an athlete that you can breathe really well, then maybe you can just stay like that for some time and wait for your immune system to deal with it. But if before that you already had some problems with breathing, you couldn't have enough air, just sitting down, and then it will be much worse for you.
So let me ask you this. If you've got a high A1C, let's say 10, 11, and through intermittent fasting and low-carb diet and some exercise and different things, and you get it down to, let's say, 5.5, a lot of people say, well, you're still diabetic, you've just brought your numbers low. But will bringing those numbers low make you less susceptible to these various afflictions? Will you be able to fight off infections, fight off disease and viruses better with a low A1C than you would have with a high A1C?
Yes, much less. Because I just told you about glycation, right? The way we measure A1C. Sugar attached to your red blood cells. For example, red blood cells live for about 120 days. But other cells in your body, they also live for some time. Some maybe 2 weeks, some maybe 1 week, some maybe 2 months, So if you have your glucose under control for a long time, most of them will be clean. There are some other ones that will still be affected a little bit, but most of them will be okay. That's why patients with diabetes, if they're going for an operation, for example, we prefer to tell them to go lower their A1C before they go to the operation. Because when you lower it, your chance of fighting anything increase. And if you have it normal for a long time, you are almost like someone who doesn't have diabetes.
Well, that's really good news, Doctor, because there's a lot of people say, okay, yeah, you've lowered your A1C, but you're still a diabetic. You're still going to have all the problems. You just got a better number. But what you're telling us is that you don't just have a better number. You have a much better chance to fight off disease, to live a healthy life, and so forth.
There are actually studies like that, that decreasing your A1C from something like, for example, 9 to 6 or 6.5, something, can decrease your risk of complications by more than 50%, even in some studies more than 70%. So this is a fact.
Well, that's wonderful. Let me ask you this. Suppose someone who's watching this says, well, my A1C is high. What do I do? What steps can I take to get it low? Of course, those that watch my videos kind of know where I stand on this, but just if you had someone asking you that, Doctor, what would you tell them in terms of being able to quickly get those numbers lower where they could be healthier and more resistant to disease and virus and so forth?
For me, in normal situation, is the same way I told you before. Right? I told you first diet and exercise, and then medications that help the disease, and then some other medications that do not help the disease, but they lower your glucose, including insulin. But in this case, I put lowering A1C first for this period, for this maybe 2 or 3 months. So for me, for this time, I would not go and say, okay, you must do it with diet and exercise. If you can do it, that's great. But if you can't, we should immediately use some medications or even insulin to just get your A1C under control. But what you do later after this, COVID-19, then is another story. But at this moment, for me, lowering your A1C is more important than how you do it.
Right. So to get your A1C down close to the normal range is a really, really big deal for our health, and we should make every effort possible to do that. I think that's what you're saying.
Yeah. For example, like when I was working in the hospital, I worked in the hospital during my master's for about 3 years or so. We normally used to receive patients that, they were supposed to do an operation, and sometimes it's even they can't wait for too long. But the doctors would not do it. They would first send them to us to reduce their A1C for at least a week, then send them back so that they will proceed. Because they know that if we don't do that, they will have a hard time healing later. And another thing that I would like to mention is that there are different types of people with diabetes, right? There are some people that maybe their pancreas are fine, but they only have problems with insulin resistance. But there are some other people that their insulin resistance is not that much, but their pancreas are not functioning that well. For those people, it's better if they check and make sure that they have enough insulin. Even if they take insulin for some time, it's okay for this time. Because insulin is an anabolic hormone. It can also help you heal. The same way it helps you build fat, it also helps you build tissues that are damaged. So at this time, it's something important that we also need to consider.
We've talked about a lot of the negatives of the coronavirus. There is one thing that I've noticed that I'm not hearing anybody say much about, and I just wanted to get your opinion on it. When I hear the number of total cases of coronavirus, COVID-19,
yes,
and then I hear them give out the number of deaths, like for the United States or for other countries. They will usually list both. So many confirmed cases and then so many deaths. And a lot of times when they're listing the confirmed cases, they're not telling quite the whole story, because there's some people that just write it out in their homes and they don't even go to the doctor. They don't think they could get a test or whatever. But, I did a little dividing, number of deaths into the number of confirmed cases to see what the percentage was. And by my reckoning, it looks to me like in the United States anyway, it's about 2%. About 2% of those who get a confirmed case of coronavirus, or who get the virus, will actually die from it. Well, I'm not hearing many people talk about that, but that's kind of good news. It means 98% are not going to die from it. Is that your perspective? Is that what's going on in China as well, or are my figures wrong?
Yeah, I think it's the same almost everywhere. But the problem is that inside this 2%, there are different people. You know, for example, this 2% is just general. So, but if you remove all the young ones that are maybe like 0.2 or 0.4%, then you'll have the older ones and the ones with some other complications that, you know, will be like 7% or 10%. For example, 7.3 in the case of diabetes and 10.5 in someone who has cardiovascular disease, you know. So there's a difference. And if someone is older, let's say older than 80 years old, it's almost like 15%. So it depends.
Right. And that's something we need to definitely be aware of, because many of the people who watch my videos and are subscribers to my channel are 50 and older. Not everybody. We have some young ones, but many are older. And if you are, probably in the 60s or beyond, your chances are much higher of dying from it. And I would guess it's smart to take even more precautions than most people do, even though we should all be taking precautions.
Yes, I think we should all, because this is a battle that we can't fight one by one. Because as long as someone is, as long as people are interacting, they can be spreading the virus to each other. Because viruses are not things that can live by their own. If you, let's say, we just shut down everything, no one goes outside for about 3 or 4 weeks, the virus cannot live. But if we do that in parts, they will still be going around for a long time. So I think coordination should be number one. Yeah, in terms of being young and old, I think it's because of your condition. Because older people normally tend to have some other complications, have some breathing problems, So I don't think the problem is just age, but it's older people they have more problems that will let them die with this COVID-19. Because if they're in your lungs and there's an inflammation going on there, if your lungs are healthy, then you can still keep breathing while your immune system can deal with it. But if you can't do that, if any small thing, for example, you climb the stairs, you're already out of breath, then for you it's difficult. So it's more about your level of fitness, I think. But younger people are fit.
Yeah, a healthy older person is going to be less susceptible to the virus than a non-healthy. But I think you're right. I think, we need to be compliant with these regulations. And, I know Americans are very independent, and we don't like anybody telling us what to do, and, who are you to tell me not to go out, and that sort of a thing. But I think these are severe times, and these are extreme times, and I think we really need to listen and follow China's example to get kind of tough on ourselves and on our nation, and let's get over this, and then we can move on. And China's starting to move on. I saw in the news this morning grocery stores filled with Chinese people. They were all wearing masks, but they were out there together, and they weren't even doing the social distancing, it didn't look like.
Well, for me, wearing mask is more important than the social distancing we're talking about. Because, for example, I can be, let's say, 2 meters from you, right? But if I cough here on something and you come later, you touch it, you might get it. But if I have mask on, everyone in the world has a mask on. No one is coughing or maybe talking and breathing the virus out to a surface or to anything. So even if you come later, you will not get it. So for me, the idea of social distancing would come after masking everybody. For me, it would go like the first one, quarantine everybody if you can. Everybody stays at home if you can. This is 100%, this is the best option. It works 100%. The second one is masking everybody. Give mask to everybody, because then we will not be spreading the virus out. So even if you come later, or the supermarkets and places outside will not be full of viruses that people can touch and put in their face. And then the third is when, we say people, stay away from each other, or maybe wash your hands all the time. Washing your hands is good. But if you have viruses all over the place, even if you wash your hands, unless you're washing them every second, then you're still in danger. So,
one controversy that I don't think they've really resolved yet, people talk about it one way or the other. Everybody agrees that the mask is helpful for the person who has the virus not to spread it. But is the mask protective of the one who does not have it? Does it do them some good as well?
It is. It does protect you a little bit, but it's not 100%. But at this point, for me, I don't care. Even if it gives me like 20% or 30% or 50%, I don't mind. Any percent is better than nothing. Mask can protect a lot of viruses, because, for example, if someone coughs near you, the ones that we fear the most are the large droplets. Of course, there are some small ones that will get through, or maybe get from the sides of the mask. But the big ones, like the ones that come with super speed, that will just go straight at you, those ones, masks can protect them. So when you start an inflammation, not just when you start an infection with, let's say, 1 million viruses and 1 billion viruses, the outcome is different. Because the less you start with gives your immune system more time to build the army and fight the virus. So wearing masks is always good. I don't even understand why in some countries people are told to not wear them.
Yeah, it's not exactly rocket science. Have you done any videos on your YouTube channel about the coronavirus?
Yes, I have. I have maybe 4 or 5 videos in English, and I have 2 or 3 in Portuguese. But those ones I normally write. I normally write before the videos. If it's in Portuguese, I write Portuguese, because I don't want to get people confused. But most of them are in English.
Right. Well, I will put links down at the bottom again, and if you don't check the links, you can just type in Dr. Vladmir Carvalho and on the YouTube search box, and it will bring up his channel. There aren't very many Dr. Vladmir Carvalhos around, I don't think.
I think there's only one.
So, Dr. Carvalho, thank you for being on our program, and you've given some excellent advice and some help. And we're glad you and your wife and your kids are all doing fine. That is good news, and let's pray this scourge passes and comes to an end, and we can be about our lives once again. Thank you, Doctor.
Thank you so much. Thank you for inviting me.